Most people know about the signs and consequences of heart attacks, but what about leg attacks?
PAD, or peripheral artery disease, is a condition that affects 1 in 10 Americans eventually. It's when there's blockages of the arteries of the legs, and that's blocked with plaque, and plaque is made up of cholesterol and calcium and other things that can obstruct the blood flow. When the blood flow is blocked, it reduces the delivery of oxygen to the tissues. So people have heard of a heart attack when you have a blockage of a heart artery that causes pain in the chest. Well, here, when you have blockages of blood vessels to the legs, you have the equivalent, which is a leg attack or a foot attack.
So, what are the symptoms and the big picture ramifications?
Pain or cramping in the legs when people are walking, and eventually can become pain or numbness in their feet when they're just resting, or it can cause wounds to form, and these wounds can eventually lead to amputation if not treated. It is a sort of marker of how much plaque there is in your body. So patients who have peripheral artery disease are at higher risk for heart attack and stroke.
Unfortunately, treatment options have been limited.
There is a procedure that they do where they can, where these physicians take a balloon, what we call balloon angioplasty, and they open up the artery to push the plaque back. However, this is not really a sustainable treatment, and the blood vessel closes up again.
But for the first time in decades, there is new hope.
Abbott is excited to have the approval of Esprit BTK, which is a dissolvable stent. When it's delivered to the area that's closed up and the plaque is pushed back, Esprit actually releases a drug. And this drug is very important because this drug is going to prevent that vessel from closing up again. But also, Esprit is there to keep the leg artery open, and that's very important as well. So you want that support of the artery for a period of time and the drug. Now, the artery doesn't need to be supported forever, and so after about 3 years, Esprit actually has dissolved and gone away, and leaving that artery in the leg healed. And again, hoping to reduce the number of times the patient has to come back to be retreated in that area.
Get more info at pad-info.com.